Every day is a struggle for Alice. She was diagnosed with depression 7 years ago and doesn't want to be identified. That was the only time she'd seen a psychiatrist. She was in hospital after trying to take her own life.
It's like a movie that is dragging for me to whether to have a happy ending or not. I'm sure there's a lot of people who suffers from that, but nobody knows about it because nobody actually talks about it.
The Philippines reportedly has the highest incidence of depression in Southeast Asia, but health officials say only a third of those troubled will seek help. Afraid to lose their jobs and friends or bring shame to their families, Filipinos with mental health issues would rather hide their problems. But psychiatrists are trying to break the stigma through education, holding conferences in public halls. Mental health patients even took center stage to show they're just like everyone else and shouldn't be ostracized. But fewer people than expected came, not even the government representatives that were invited.
It is also said that by year 2020, it will be the second highest ranking reason for disability. Okay? And we would like to step ahead and be able to address the needs of the Filipino people.
With no comprehensive or systematic mental health program, the needs of the Filipino people are being addressed like this. This is just one of less than 10 government-run mental health centers. They're underfunded and undermanned. There's only one doctor on duty here a day, and in addition to looking after nearly 200 stay-in patients, that doctor has to look after all these people that come as outpatients. Less than 5% of the national health budget goes to mental health care, and there are only 500 certified psychiatrists in the country. Most of them are in private centers. This is cause for much concern in a country overrun with natural calamities that can create mental distress in millions of survivors.
I believe it's failing on the government's part. No? There should be more consistency in giving help to these people and forming organizations or agencies that will take care of it.
Alice still considers herself fortunate. With the help of her family, she has found a way to cope. Thousands of others have been abandoned, left to struggle on their own. Marga, Ortigas, Jazeera, CAVITE in the northern Philippines.